strength testing of the hand and wrist, you can also perform resisted isometrics. Again, as we did before, you can do forearm supination and pronation, so don't let me rotate in. So here you're testing the resistance of the supinators, and then don't let me rotate you out. Here you're testing strength into pronators. And wrist extension and flexion, so go ahead and bring your wrist into extension. Don't let me push you down. Good, and then make a fist, and then go ahead and flex here. And again, I like to keep the elbow straight. Don't let me, good. And again, keeping the elbow straight or bent, depending on how well you know your anatomy, you can start to tease out different muscle groups, depending on the position of the rest of the arm, knowing which muscle group crosses the elbow joint. Radial and ulnar deviation, again, I'll have the patient make a fist because it's easier to grab onto, and go ahead and bring your hand out towards me this way, and don't let me move it back. For ulnar deviation, and go ahead and move it towards you, don't move it back. For radial deviation, again, I've always got my stabilizer hand just proximal to the joint. For finger extension, again, depending on which muscle group, you can get really picky with this if you know your anatomy and you know which muscle attaches at different spots in the fingers. For just a real general test, don't let me push your fingers down. Good. And then go ahead and curl your fingers down, and then don't let me straighten them out. Real general test for finger flexion and extension. Abduction and adduction, again, I'll often have patients go ahead and hold both hands out. I'll slide my fingers in between. Don't let me pull them out, and you can get a good idea of how strong they are one side compared to the other. Now hold them out wide, and then don't let me squeeze them. Don't let me squeeze them, don't let me squeeze them. And oftentimes with the hand, there's going to be a discrepancy side to side because many people are very dominant one hand or the other, so you need to take that into consideration. For thumb extension, again, thumb extension is coming up that way. Don't let me push down, hold it, good, and then hold it in towards your other fingers, and don't let me pull it away. Good. There's for thumb flexion. For thumb abduction, pretend you're holding a pop can. Good. Now hold it there. Don't let me push it in. Good. And then go ahead and bring your thumb to your palm. Don't let me pull it away. Good. There's thumb adduction. For opposition, you want to, this is the motion of bringing the thenar eminence closer to the opposite side of the hand. And so what you want to do is you can kind of feel how you can fold the hand manually. So what you can do is say, passively bring their hand together. So you're collapsing that arch there. Now don't let me peel it apart. Hold that palm together. Good. If you're suspicious of one side or the other, you can stabilize one side, and don't let me push this back. Hold, and really direct your attention to one side or the other. Don't let me push this back, so you can test one side compared to the other.